Good morning. This is Dr. John Bennett from Miami. It's morning time here, and it's I believe it's a little later in Greece, late afternoon. We have the pleasure today of having Mahmud Awadallah MD. He's a general surgeon from Athens, Greece. And today, Mahmud's going to talk about laser surgery in Xanthalasmas.
Xanthalasmas.
Xanthalasma. I got that.
Yeah, it's a Greek word. You know, it's a combined Greek word, and it's combined from xanthos, which means blonde or yellow, and elasma, which means plaque. That's why they are generally known as yellow plaques.
Very good. Like a lot of our medical terms, it has Greek derivations. Anyways, I'd like to welcome Mahmud. And Mahmud, I'll let you introduce yourself and then go into your presentation.
Okay, let me start with my slides.
Could you just talk a little bit about yourself first, Mahmud?
To introduce myself. Yeah, this is Dr. Mahmud Awadallah talking from Athens, Greece. I was born in Jerusalem in 1958, and I finished my high school in Amman, Jordan in 1976. After that, I followed my medical education in the University of Cluj-Napoca, Romania. I graduated from there in 1983 with a degree of general practitioner, GP. I practiced general medicine for about 4 years, 1 year in Greece, and 3 years in the Royal Medical Services in Jordan. In 1987 until 1992, I followed my training courses for general surgery in the District General Hospital of Athens. And since that time, I practiced general surgery in Greece. In 2003, I followed some courses of laser cosmetic surgery, and I started to use this surgery too since that time. So.
Okay, very good.
Okay, today we are going to talk about a skin lesion known as xanthalasma or yellow plaques. Let me share the slides.
Okay.
Just a moment. Sorry for that.
Okay, you got the wrong screen there. You're sharing the wrong screen, I think. You picked the wrong screen.
Yeah. Just a moment, please. Sorry. There is a problem here. Why?
Yes, there it is. There it is.
Here is
what is xanthalasma?
Yeah.
Very good.
So this is, as we said, it's xanthalasma, yellow plaques. Okay. What exactly is xanthalasma? Xanthalasmata are benign cholesterol deposits around the eye. The typical growths appear as flat, soft, or hard yellow plaques over the upper or lower eyelids, most commonly on the medial aspect of the eye. There are some important highlights which must keep in mind when dealing with the case of xanthalasma. First of all, and the most important, is that xanthalasma normally is a sign and not a disease. Xanthalasma by itself is not harmful, but it may be a sign of serious underlying systemic disease. Xanthalasma is more common in Asian and Mediterranean populations. Xanthalasma can occur in people of any age, but most commonly we see them in middle age or older people. It's most commonly in females than in male. And here is a notice that despite the fact that these lions are considered rare in literature, we noticed an increase in their incidence in the last 3 decades. Causes of Xanthalasma. One important thing that we have to know that the exact cause of Xanthalasma are still unknown. A variety of systemic diseases and lifestyle may constitute a predisposing factor for Xanthalasma development. About 50% with Xanthalasma have high cholesterol levels. You are more likely to get Xanthalasma if you have one or more of the following: high LDL cholesterol level or low HDL cholesterol level, familial hypercholesterolemia, primary biliary cirrhosis, this is a liver disease which can raise cholesterol levels, hypothyroidism, and finally, Xanthalasma may also be linked to other heart disease risks such as diabetes, high blood pressure, obesity, and smoking. What is the significance of these lines? Once someone gets Xanthalasma, he has to take in consideration 2 questions. First, is it harmful for me? And second, what I have to do. For the first question, usually these lions aren't harmful, but if you are bothered by their appearance, there are many treatments that can take them off. Xanthalasma itself won't hurt you. In 50% of cases, it could be a sign of a serious underlying disease, such as heart and vascular disease, hypercholesterolemia, liver disease, and hypothyroidism. For the second question, once you get Xanthalasma, you have to consult your doctor as soon as possible to rule out any underlying disease. So don't ignore it. Xanthalasma usually won't go away on its own. The lions will either stay the same size or get bigger over time. If you are worried about your appearance, you may want to have these lions taken off. And here is the most challenging part of the presentation: the treatment modalities used in removing these lions. A variety of treatments have been proposed for Xanthalasma removal, including lotions and chemical peels such as bichloroacetic acid or trichloroacetic acid, cryosurgery, laser removal, and surgical removal. One important thing is to have in mind the size and the site of the lion, the skin type, and the existence or not of an underlying disease. These are very important factors to decide which treatment modality is the best. Generally speaking, these treatments work well, but they can cause side effects such as scars, skin color changes, deformity of the eyelids, and recurrence of the lesion after the treatment. Why do we prefer the treatment with CO2 laser? From our point of view, we consider CO2 laser treatment is the treatment of choice for these lesions, for these lions. The problem with lotions and chemical peels is that these are not strong enough to remove completely the lion, and often multiple sessions are needed, and the results are disappointing. Surgical removal, from the other hand, seems excessive for these small harmless blemishes. Scar and deformity are common in lesions more than 3 millimeters. Recurrence rate still high, more than 40% of cases. We prefer CO2 laser for vaporization of these lions. Majority of patients only require 1 session. For those patients with large lions covering almost the whole of the eyelid, More than one session may be recommended for safety and best results. With CO2 laser, xanthalasma can be removed layer by layer down to the muscle. The underlying tissue contracts, leaving a significantly smaller defect than the original side of the xanthalasma. Keeping in mind that a deposition may be present under the skin near the seen lesion, we can vaporize these deposits, keeping the skin intact. So what is the advantage of this? So with laser vaporization, we almost remove completely the lesion, and we keep the skin almost intact. So scars and deformity are minimized. That's why we prefer this treatment modality. And here is the machine we use in our clinic. It is the Sergilase from LMT Laser Trade Company with wavelength of 10.6 microns per 15 watts with a pulse mode of single, repeat, and continuous shoot, and laser delivery with 7 joint articulated arms, which make the use of the handle very easy for the doctor. So now let me present a small video. You see the video? No?
Yes, it's fine.
You see it, okay?
Yes, I do see it. Can you hear me okay? Okay.
Yeah. So here we see this man is about 38 years old with 2 xanthalasmata on both eyes. He has no underlying disease. And now we see the laser, how it removes the lesion layer by layer. Local anesthesia was used for this procedure. Here we see after 10 days, a small scar is seen, and here is after 3 weeks, the scar is off. That's it. I am all yours, Dr. John.
Okay, very good. Nice and concise. Okay, you can get off the screen share. Just click on the green arrow again, Mahmoud, and we'll just have a little discussion. Just click on that green arrow again, and it goes off the screen share. There you go. Okay, very good. You know, one thing I want to say is that I can tell the viewers is that sometimes you have a tumor or growth that's benign, but its location makes it more than benign. Like I'm sure there's problems with irritation with people that causes irritations sometimes, right? Of the eye, conjunctiva.
Yeah.
And that in itself can make the patient want to get rid of it.
Yeah, a laser can help us very much in dealing with such growths in a location which is very dangerous, and you don't have a lot of skin to sacrifice. So excision is very dangerous. So with laser, we can do the same work as in excision and with better results from the cosmetic point of view, better cosmetic results. So around the eye, because we have a little skin, we cannot sacrifice the skin. Otherwise, we will make deformities of the eyelids. The most important thing is the ectropion of the eye, of the eyelid. This means that the eyelid comes out, it returns outside. It's a very serious deformity and complication of excision of large nodules or large patches. So lasers helps us very much to avoid these scars and these deformities.
We're losing your sound there.
You don't hear me now? You hear me now?
Yeah, it's okay now. It's okay now.
Yeah. So as I don't know what did you lose, but I said that with laser surgery, we can avoid scars and deformities.
Right. The scars that you would get from sutures, correct?
Yeah, from sutured and from the cutting mold of the lesion.
Right, cutting the tissue.
Yeah.
Yeah. Well, I know in America, if you had to do this procedure, you have to have some kind of certification. Is it the same in Greece? Like a general surgeon has to attend a course before he does that, or?
You may have certification or not. If you attend courses, you take some type of certification that allows you to practice this type of surgery.
Right.
Yeah, because it's not something difficult for doctors to perform.
Right. Right. Oh, you've been doing this for 10 years, correct?
For more than 10 years, yeah.
10 years. Is your practice solely laser surgery?
No, not only laser surgery. I practice general surgery, mainly general surgery, but in my office, I have a lot of laser types. I practice all the kinds of laser surgery in my office because laser, usually you don't need to go to hospital. It can be done easily in your office. In some cases, you may need local anesthesia. Nothing more, nothing less. It's safe surgery.
Okay. Okay.
Okay.
Okay. Very good. We talked before about the protection that a surgeon uses for the eyeball itself. You say you use some kind of a metal plate to put on the eye during the procedure?
Yeah, we have two types of eye protections. One type is with Google, it's external type, and the other type is plastic lenses which we introduce under the conjunctiva.
Okay.
It's like a lens we wear usually for ophthalmic or eye problems. This protects completely the eye, and we don't have any problem with the eye.
Very good. Okay, Mahmud, I thank you very much for a very concise, clear presentation, and I look forward to hearing more.
Okay, we will be in touch. We have a lot of laser cosmetic surgery presentations. So we will be in touch continuously, and we will present all our experience. We will share our all experience with our colleagues.
Okay, how do you say goodbye in Greek?
Greek, Yasu.
Yasu.
Yasu, Yasu.